Good morning. My name is Mel Cavell. I work in CCU at Princeton Community Hospital. Today I'm going to talk to you about pain associated with diabetes. Here in West Virginia, we have 1 in 10 adults suffer from diabetes. That's a big number. Uh, the pain, one of the type of pains that come with diabetes is neuropathic pain. It's nerve damage that causes pain, and the nerve damage is usually secondary to chronic elevated blood sugar. Now, people who suffer from this type of pain, they have numbness, tingling, burning. Sometimes they will tell you, I feel like I have raw skin. They complain of shooting pain or deep, dull, bone like ache type of pain. They also sometimes complain, or they will tell you, I feel like I I have electricity in my legs or in my hands. Usually, doctors manage this medication with tricyclic antidepressant. They, in combination with Neurontin sometimes. Sometimes they give them Aricept for kind of like a restless leg syndrome. Uh, but most of them, they are poorly managed. Their pain is not managed. A lot of them, they live with chronic pain, and that affects the quality of life, their quality of life. Like physical functioning, for example, is affected. They cannot exercise because they are in a lot of pain. And exercise is very important to manage their diabetes. Exercise is very important for everybody, but especially diabetic patients. They have a difficulty uh, performing activities of daily living. For example, some patients with neuropathic nerve pain in their fingers have difficulty buttoning their shirts, difficulty even picking their pills, their medication. I'm sorry, they have difficulty uh, tying their shoelaces. They have difficulty with their work. If they have to type or they have to write things down, they their recreation suffers. They kind of like isolate themselves, and they don't have fun, as much fun as they want to, or as a usual person, a normal person will have. Their family suffers. Like if the kid is diabetic, the wife or the husband, the whole family suffers because the whole dynamic changes. Everybody has to make room for or think about the diabetic person. Like not only themselves, everybody in the family is affected. Between husband and wife, the intimacy sometimes changes. These patients usually they tend to socially isolate themselves because they are in a lot of pain. And if I am in pain, I want to stay in my room and take care of myself. And that's exactly what they do. They stay in their rooms or they stay in their house and they take care of themselves. They just want to take the pain away. Psychologically, they get depressed, anxious, sometimes they are angry. They have sleep disturbances. If they are in pain, they cannot go to sleep. They have self-esteem issues because they cannot live their life the way they want to. Um, Socioeconomically, um, they suffer because of the healthcare cost for diabetes. It is very expensive to be a diabetic. Some people think that diabetes is a rich person disease, but that's not true. Most of the people here in West Virginia and around the world that are diabetic, they are usually from a lower socioeconomic group. They suffer from disabilities, and that will affect their work. They can have limbs amputated. They lose work days, and they lose money doing that. All of this affect their money, and once the money is affected, a lot of other aspects of their lives get affected too. Now there is a leg pain. I have to talk about that too. A lot of people with diabetes, once they have they stay in with high blood sugar for an extended amount of time, and then they decide, okay, my blood sugar is high, I'm taking my insulin. They take their insulin that brings the blood sugar sometimes fast, and that gives them leg cramps. It gives them leg cramps because it messes up with their electrolytes, in their body, and once that happens, they start having leg cramps. And we all know that the heart is also a muscle. So if your legs are cramping, I wonder what your heart is doing. So that is, if you have leg cramps, that's a medical emergency, and you need to go and seek medical help. Now, I work in CCU, and we get patients with diabetic ketoacidosis, and those patients get insulin drip. And once you are on insulin drip, you have finger sticks every hour, at least every hour, sometimes less. And if you are there for 24 hours and you are there 24 hours on an insulin drip, sometimes it's more, although not very often. So if you are on insulin drip for that long, your finger sticks, it's like it's too much. It's like you going and checking that patient's blood sugar every hour during the day and at night time. That patient is not resting. That patient is in pain. That patient is not resting at all. He's not happy. Usually they're not happy, and I feel so sorry going there and checking their blood sugar. I think we need to find a solution to that, because with all the other sticks combined with the blood sugar sticks, it's just a little bit too much. We do technology, like we do have a solution. We just have to implement it. We need to introduce it to the patient either outside of the healthcare system or inside the hospital. There is this device. It's called a FreeStyle Libre meter, and it looks like this. This is the meter, and this is a sensor. Now, this is just like the regular blood sugar meter. The sensor, although it looks like this, once it's in the body, when you put it in the body, it's just the size of a quarter, and you can put it in your arms, your leg, or in your belly, and it does not. I mean, you can put it anywhere. It is small size. You can wear it for 10 days. You don't need finger sticks. It is water resistant. You can swim with it, shower or exercise. It is painless to apply and wear. And it automatically stores your blood sugar during the day and the night for up to 1 month. So at the end, if you are having an appointment with your healthcare provider, you take this device with you. He will hook it to a computer and download the information that they need. Now, this is expensive. This device is one-time purchase of like $60, and this one, the sensor part, costs like $36 for 10 days. So the total goes to like $120 a month. It is very expensive, and it can be covered by Medicaid. Now, how you put this, you kind of like just hold on to the device, you clean your skin with alcohol, let it dry a little bit, and then you just push. And once you push, you have the sensor on your arm, and you have a picture on the handout that I gave you, and you can see it. It's very easy, very practical. It makes the patient's life easy, and it makes I think the healthcare providers' life easy too, because they can have a record, an accurate record of their patients' blood sugar, so, and they can manage it better. So if you go to your healthcare, if you are a nurse, you need to inform your patients of this device. It's miracle. It's a miracle. And if you are a patient, talk to your healthcare provider next time you see them and ask them for that option. If you can have this device so you are not pricking your fingers like 4 or 6 times a day. Wish you all luck, and thank you for listening. Until next time, thank you.